Amid the barrage of pharmaceutical, technological, and even supplementary medicine treatments for all that ails us, back to basics dieting and fasting present as an oasis of simplicity that doesn't impose particular financial strain. We're prone to question, though, for one, if they're really viable for the average human being to put into practice, and for two, if they're really effective relative to the barrage of other treatments out there. As it happens, on both counts, the fasting mimicking diet is hitting home runs. Low in calories, carbs, and protein, the fasting mimicking diet, or FMD, cuts the severity of all-out fasting while delivering many of its benefits. And we will explain how that works. FMD also blazes a trail on the kidney detoxification and even regeneration fronts, and most notably, in the context of chronic kidney disease, that which currently impacts over 35 million people in America. To walk us through key research results and how the FMD protects kidney health, and crucially how the diet can be readily put into practice, is Dr. Jason Fung, best-selling author of the Diabetes Code and the Obesity Code. As a nephrologist, a physician specialized in kidney health, Fung is also a leading authority on intermittent fasting and low-carb dieting. Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendon Fallon. Dr. Fung, fantastic to have you join us on Vital Signs again.
Thank you. Thanks for having me.
And excited to have you here to give your insights on the fasting mimicking diet, which I know is showing striking results in research in terms of chronic kidney disease, or CKD. We've talked about this before, and we'll get into this dimension of the fasting mimicking diet a bit later today. But as far as kidney health in general goes, detoxification, kidney repair, I'm glad that you'll be here to outline the mechanism of the fasting mimicking diet that is producing these results, how it can be practically applied, and what is actually coming through on the research front.
You know, kind of exciting recently is a study that was done by Nutra, which is a company which makes a fasting mimicking diet, which is not a full fast, but it's a sort of a modified 5-day fast. And what you're supposed to do is once a month, you have a 5-day fast, but it's not a full fast. They give you some food to take, on day 1, day 2, day 3, day 4, day 5. So it's a sort of a set schedule that is scientifically formulated to make sure that you're getting enough nutrients. At the same time, you're not stimulating a lot of insulin and mTOR and all that sort of stuff. So it's used sometimes for weight loss, which is very good. It's used for type 2 diabetes. And again, there's lots of data that fasting and fasting mimicking diets, which, basically are diets that are like fasting, but not actually fasting, can help with type 2 diabetes, as we've discussed previously.
Why would you do a fasting mimicking diet over doing fasting?
Yeah, that's a great question. A 5-day fast with nothing but water sort of thing is not the easiest thing in the world to do. You get hungry, basically. And because of that, while you can tell people to do it, many people won't. And even if they do it, they may do it once and then not do it again. So it makes it difficult. It's sort of like if you tell somebody, oh, you should run a marathon, that's great. They may or may not do it, though, because it's difficult. So these longer fasts are powerful, but they're not always easy. So the idea is to not just say, okay, well, people are not going to do it, forget about it, right? Because there's a lot of benefits for that. So the idea is to make it easy for them to do. And that's how this fasting mimicking diet was actually developed. It was developed to make it easier for somebody to do a 5-day fast, which is not, it's a modified fast that gives you sort of most of the benefits, but is a lot easier. So if you can make fasting sort of still preserve sort of 80% of the benefits, but make it 50% easier, well, that's a pretty good trade-off. Because if you just tell somebody to do 5 days every month with just water and tea, your compliance rate will just plummet after a couple of months. So certainly people can do it, but it's because it's something that often needs to be done over and over again, right? Because often we eat too much, it's the holidays and stuff. It makes it a lot easier. So that's the rationale. And to their credit, they've put a lot of money into research. So they've published 20 plus studies on this fasting mimicking diet in a range of conditions. And that's why I'm more confident now that you can say, well, yeah, there are actually a lot of the benefits that you might have expected from fasting, but you can do it with this instead. The other advantage of doing a fasting mimicking diet as a structured program, it's easier to follow. So instead of saying, well, day one, I'll do this, and day two, I'll do this, and making it up as you go, it's sort of structured so that you have, day one, you have this, day two, you have this, day three, you have this. So the whole thing is easier to follow. It gives you a structure to follow and just makes it sort of lays it out for you exactly sort of what you're supposed to do, when you're supposed to do it, what you're supposed to take when you do it, right? So that's the advantage of a fasting mimicking diet over fasting alone. If you're super, super, super disciplined, well, then you can save the money and just do it yourself. And certainly you can do that. It's no problem if you want to do that. But, like anything else, it's just there as an option for you.
As mentioned, the FMD has come deeper into the spotlight following the notable results of the 2024 L-Nutra study. The study found that in rats, 6 cycles of fasting mimicking diet, or FMD, slowed deterioration of kidney structures and function. This was particularly apparent with the podocytes of the kidney's glomerular filtration barrier, or GFB. This is what allows small molecules like water, electrolytes, and glucose to pass into urine, while keeping larger proteins, cells, and other macromolecules in the blood. This is essential for preserving proper kidney function and stopping proteinuria, which is excess protein in the urine. Podocytes in particular prevent leakage of large proteins into the blood and urine. In chronic kidney disease, the loss of podocytes causes the disease to progress irreversibly, and this is where the results of the fasting mimicking diet study are especially striking. 6 cycles of the diet promoted signatures of podocyte renewal, also restoring the filtration structures of kidneys. In addition, a pilot study in humans, 13 patients with chronic kidney disease found FMD cycles of 5 days each month for 3 months were kidney protective, this including reducing proteinuria. All in all, pointing to a need for further testing of the fasting mimicking diet for the treatment of progressive kidney diseases. One thing that caught my attention in watching one of your videos, Dr. Fung, in the context of chronic kidney disease in particular, what it is with the fasting mimicking diet that could be having the effect, and you suggest that it's the reduction in inflammation that could be leading to autophagy, as I understand it, like recycling the unnecessary cell matter, and this leading to regeneration. Could you say a little bit about that, like how this works?
Yeah. So in the latest study with the fasting mimicking diet, what was very interesting to me is that, so for type 2 diabetes, the mechanism seems relatively straightforward, right? You reduce the amount of damage from the diabetes, you reduce the amount of glucose in your system. The glucose is what's causing the toxicity, and therefore you have less glucose, less toxicity. So that's fine. They did another study, which was just in chronic kidney disease. So not diabetic kidney disease, but different kidney diseases like IgA nephritis and other types of glomerular nephritis that aren't related at all. And they also showed a reduction in the damage to the kidneys. And that's really interesting because that doesn't have anything with glucose or weight, which is what we typically associate in terms of benefits with fasting. But you have to understand that fasting actually causes a complete change in how your body works. So when you're eating, you're stimulating nutrient sensors like insulin. It tells your body nutrients are coming in, and that's very pro-growth. So when you're trying to rebuild proteins and stuff, you're trying to build muscle, you're trying to store fat. That's all stimulated when you eat because nutrients are available. When you don't eat, your body actually has to do the opposite. So if you think about the human body, when there's no food available, like it's a time of famine, for example, you don't want your body to grow, because if you grow and there's no food, you're just going to die faster, right? So you want to shift your body. What happens is that when those nutrient sensors go down, insulin, mTOR, or the nutrient sensors, your body shifts to sort of a regenerative sort of survival mode, not growth, but maintenance mode, right? So the whole idea is that when you do that, you're going to shut down a lot of the things that are happening because you need to conserve energy, right? There's no nutrients coming in. You want to conserve energy. So what happens is that you have this whole shift into this maintenance repair mode, and you're going to have less inflammation because excess inflammation is it's energy. It takes energy. So you don't you want to shut it down. So your inflammatory responses go down. We hear lots of cases where people are saying, oh, I had all this inflammatory things, it got better. I had all this joint pains and stuff, it gets better because of this reduction in inflammation, a reduction in excess inflammation. And that turns out that if you have an inflammatory kidney disease, it could actually prevent it from getting worse, which is fascinating because most of the time that we use anti-inflammatories like prednisone, they're super powerful anti-inflammatories, but they have a ton of side effects. So if there's a way to sort of tone down this inflammation, it actually can be immensely powerful. In fact, a lot of the chronic diseases that we face, so chronic kidney disease among them, but also atherosclerosis, so the blockages of your arteries are highly inflammatory. That's, when you think about, people think it's this cholesterol sludge that's causing the pipes to get all filled up. No, it's not just that. It's actually a highly inflammatory lesion. That's the atherosclerotic lesion is actually highly inflammatory. There's all these smooth muscle cells that are regenerating. There's all this excess inflammation. So if you can turn down that inflammation, and instead of trying to get the things to grow, you try and get them to shrink, that can actually cause a lot of benefits. And in fact, what you do is you also get a lot less of this chronic scarring that happens. The fibrosis that happens in a lot of these organs also goes down. So you have this reduction in fibrosis, which might actually play a role. So there's less inflammation, less fibrosis that's happening in the kidney, which translates into preserved kidney function down the line. And it's interesting because it's not impacting directly the cause of the kidney disease itself, which is, diabetic kidney disease. You can understand immediately why it would be beneficial, and that's important. But even in cases that have nothing to do with the diet, these other diseases that we see in the kidneys, just any kind of chronic kidney disease might be improved by this fasting mimicking diet, and by extension, any sort of fasting. But we don't know, do you have to do 5 days? Do you have to do 3 days? Do you have to do, 1 day? Is that enough? We don't know. All we can say is that the fasting mimicking diet, which is the protocol that they studied, seems to have this benefit. And really, I've never seen any other benefit from a dietary standpoint, any other dietary intervention that's made any difference for chronic kidney disease. So this sort of very preliminary early data is super exciting because it offers people all of a sudden an option. It's like you could do it if you want to, like anybody can do it. So you should take your medications, you should take whatever your doctor prescribes for you, you should follow their advice in terms of, the medications, the checking your blood pressure, all that sort of thing. But you can also add, if you want to, a fasting mimicking diet, and there's a potential there. And again, I'll stress that it's relatively early. The research is literally like less than a year old. And it's the first one I've seen. So obviously, as things go through, it's an exciting sort of adjunct, right? And it translates very quickly into something that is beneficial to the regular person like you and me. Like, how sometimes there's these scientific breakthroughs, but it'll take 10 years, right? It's sort of like the transplants with a pig kidney that they did at NYU. Very exciting, but it's not like you could walk out tomorrow and get a pig kidney for transplant. It's a very complicated process. That's not what we're talking about. We're talking about something that you could go out and buy today, right? And then implement it for yourself if you want to, understanding that there's not that much risk to it, because it's been well studied. It's been used for a long time. Fasting itself has been around for thousands of years. So there's the relatively low risk to doing these sort of interventions, and potentially a benefit in terms of chronic kidney disease that would add to any other benefits, of your other treatments. And that's really where this sort of stuff is exciting about the fasting mimicking diet, is because they've put the money into doing the research. They're exploring all of these potential benefits. And I'll tell you that not only are they looking at the chronic kidney disease, but they've also done studies in, cancer, for example. They've done studies in terms of specific types of colorectal cancer. They've the diabetes we talked about. So all these other diseases that are super important may be helped by fasting or the fasting mimicking diet. So that's a brand new avenue for benefits, right? Like drugs are great, and drugs have benefits in the diseases that they're designed for, but oftentimes you're already on one drug, so you're only getting an incremental benefit. When you add a whole other treatment, like a dietary treatment, if you're not on anything, you're getting a huge bang for your buck, because you're hitting on a different pathway completely. So therefore you're getting the maximum benefits of what you're trying to do.
It sounds incredibly promising, and I think you've answered my next question, which was going to be about inflammation to some degree. Inflammation, which seems to be at the center of so many health problems that are manifesting these days. And it brings to mind a friend of mine who has been on the carnivore diet for 2 years now. And I know within that carnivore community, there's an understanding that the weight loss, the loss of joint pain, different benefits they experience is due largely to the absence of oxalates in the diet. And I looked this up, and in some places it's identified, oxalates are identified as an anti-nutrient. These, as I understand, found in fruits, vegetables, particularly leafy greens, nuts, grains. So they see this as a primary cause of inflammation. What's your take on this?
Yeah, I think it's really interesting, because I think that the way that modern food is made, like a lot of ultra processed foods, have all these chemicals. And of course, it's very topical with RFK Jr. And they're just talking about banning red dye, number 3 right now. So it's very topical because there's a lot of chemicals in the modern diet. And it's not just chemicals in terms of directly added, but herbicides, pesticides that are used to grow a lot of these sort of monoculture crops that we have. So grain, for example, compared to 50, 60, 70 years ago, it's changed a lot. The type of grain that we use, the way we grow it. They talk about this glycophosphate, for example, in the wheat that is grown, that is used in parts of North America that aren't used in, say, Europe, for example. So there's a lot of chemicals that get introduced in the foods that we eat. If you eat boxed foods, right, there's chemicals. You see it on the ingredient label, but there's also chemicals in the way that it's made. So milk, even, for example, sometimes they give special hormones to the cows to make them make more milk, but the hormones, of course, get into the milk. That's banned in Europe and Canada, but not in the United States, for example, which is a big concern. But the point is that we don't know what happens in the body with a lot of these chemicals, because they're just not studied that commonly. You presume that, hey, if somebody takes it and they don't die, then they presume it's safe for you. But you don't actually do a 20-year study where people are eating, chemically laced foods for 20 years and know what the effect is. In other cases, people talk about, the oxalates for sure, but also a lot of plants have sort of things that people react to. So we know, of course, for celiac disease, it's the gluten or the gliadin protein, but perhaps it's also the wheat germ. And so there's other chemicals within foods, or oxalates, as you say, that people may react to. And when you react, the body only reacts in a very stereotyped way, which is inflammation. So inflammation is not actually, it's a natural thing. So if you cut yourself, what you see is that after the bleeding stops, you get this sort of red rim around where you cut yourself. That's inflammation, and that's helps bring healing proteins and stuff to stitch it back up. The problem is when you have excess inflammation. So that's fine when you cut yourself. It's supposed to get a bit inflamed so that it heals, but you're not supposed to have all this inflammation in your bowels or in your kidneys or in your anywhere else that you're not supposed to have it. And this inflammation, this excess inflammation that's happening in the body, is going to cause problem, because while you want scar tissue to form where you cut yourself, right? That's how it heals. You don't want scar formation in your kidney, and you don't want scar formation in your blood vessels, but that's what's happening. And it could be in reaction to some of these proteins or chemicals or what have you. And it could be to other things. So there are inflammatory mediators in the body, things that tell you to increase inflammation. So one, it could be the chemicals themselves, or whether it's the certain foods, the oxalates or the gliadin protein or the herbicides or pesticides that get into the foods. But what is it? So decreasing those types of foods, like with the oxalates, may help in that situation. But any kind of excess inflammation can also be dealt with more generally with the fasting, because again, fasting is going to decrease energy to everything, and then the body's like, well, if I'm going to have to decrease energy, it's sort of like when you get these budget cuts, these across the board budget cuts. It's like, we get this at the hospital all the time. It's like every department gets to spend 2% less, sort of thing, right? That's what happens in the body when there's no food coming in. The body's like, okay, well, everybody needs to shut down a little bit. So if you have too much inflammation, well, that's actually a good thing. And then the body goes into this sort of repair mode. So that's what autophagy is as well, right? Autophagy is this idea that when you put your body into this repair maintenance mode, you're going to get rid of some of the excess cells, excess inflammation, excess all this stuff. So there's going to be less inflammation and less fibrosis, and that's less scarring. And so less scarring in the kidney, for example, is going to be a benefit for chronic kidney disease, but could be potentially beneficial in a huge number of other problems, especially cardiovascular disease. So heart disease and stroke could be very important, and it could be potentially important in cancer, because, as I mentioned, the fasting mimicking diet, they're doing studies in cancer cells, and some of that is super promising. But again, same thing, if you're shutting down, you're going to decrease the energy to cancer cells. So our body actually always has cancer cells. They're always floating around, and your body is normally just fighting them. But if you can tip the balance against these cancer cells by limiting the availability of food for them, hey, that might be a real improvement. So, there's ongoing studies about how you might be able to use this in cancer treatment, how it might be show an improvement in heart disease. So all of these diseases, these chronic diseases that we're facing now, because, in today's medicine, we're not so worried about the acute infections. I mean, things like pneumonias and diarrheal diseases and so on, TB, they used to be a real problem 100 years ago. They were the things that killed most Americans were infectious diseases and other diseases like that, hepatitis. But if you look at really what kills Americans now, two diseases above all the other diseases by far, and that's cardiovascular disease and cancer. Those are the two biggest killers of Americans by far. Like, it's not even close. Those two are way out there. So anything, and you can't treat that with, antibiotics or antivirals or whatever. You can't prevent it by, wearing a mask sort of thing. It's stuff that you have to look a different way. And there are lots of different things that are important, such as, good diet, maintaining a good weight and all this. But the diet is one of these things that really deserves a lot of attention. And a new dietary intervention such as fasting is very, very exciting, because when I started talking about fasting with the Complete Guide to Fasting, that's almost 10 years ago now, it was very frowned upon. But now we're taking it sort of the next step. Yes, fasting is going to be beneficial. Can we make it easier? Can we make people more accessible to people so that they have a structure, they know what to do and when to do it exactly?
Coming up, Dr. Fung outlines how the fasting mimicking diet is put into practice, outlining the kinds of things he eats when he's on the FMD. First, though, we know this diet shows promise for reducing kidney damage and other aspects of chronic kidney disease. Here's a snapshot of my interview with Dr. Fung, giving his nephrologist or kidney specialist overview of CKD.
When you start seeing protein in the urine, what it means is that your kidney has a big hole in it that's allowing that protein to fall through. And that's often the earliest sign that you'll have kidney disease.
They are the body's detoxification and blood particle processing units. If they're healthy, they're cleaning half a cup of blood a minute.
The signs and symptoms of the fatigue, the nausea, the vomiting, this sort of sallow complexion. By the time you get the symptoms, the kidneys are sort of 90-95% gone. But if you catch it early enough, you can figure out what's causing the damage and try to reduce it or slow it down, or even now potentially reverse it a little bit.
What can be done on the diet and lifestyle side for managing and preventing chronic kidney disease? Afterward, find the link to that video at the top of the comments and also in this video's description below. And to get notice of new Vital Signs videos, follow me at Vital Signs Brendon on Instagram and Facebook, and at C Vital Signs on X. With it appearing to be such a potent instrument in a prevention strategy against not just kidney problems, but potentially other diseases as well, firstly, is this something that just everyone should be doing? And secondly, is there a reference for specifically how to do this, what to eat, the kind of time intervals, and how are you recommending that patients do this?
Yeah, so this is the thing with fasting that's often difficult because it can be, very short to very long. Do you do it every day or do it once a month? And it can be anything in between with fasting. It's actually quite different. Now, in the past, people used to have traditions around fasting, right? So you would not eat after dinner, you wouldn't eat until breakfast. You got 12 to 14 hours of fasting every day. Then you might have a period of time in the year, say winter, where you're just not eating that much, or you might have a period of time, say during Ramadan or during Lent or during Yom Kippur or whatever, where you're sort of prescribed a period of fasting, and you do that along with the rest of your community. So it's traditional what fasting people used to do for fasting. But everybody has different traditions. That a lot of those traditions have been lost. People eat whenever, they snack whenever, they eat bedtime snacks, they eat, all over the place. So the whole thing with the fasting mimicking diet is that it gives you a prescribed thing to follow, which has been sort of tested and scientifically developed. It's a plant-based formula, and they basically try to maintain most of the benefits of the fasting, even though you are still eating. Because again, different foods have different effects on the body. So when you're eating certain foods, it's going to stimulate certain hormones. It was developed to try to sort of keep the same sort of hormonal profile as an actual fast. And that's where it's useful, because it tells you it's sort of every month, do it for 5 days, right? And that's a great way to do things. You can also follow a schedule, that you make up yourself. Say 24 hours of fasting 3 times a week, and then once a month do 3 days of fasting. You could do your own schedule, but there's no good data on that, because there's no study that says, well, if you do this, then you'll get this benefit.
Is there such a thing as a bona fide schedule that you'd recommend people look at?
I make recommendations for people, but usually, 24 hours of fasting 2 to 3 times a week, for example, is a good way to start. But then I adjust from there depending on how people like it. Some people like the short fast, some people like the long fast. So there is no schedule that you can say, wow, we did this study on, 50 people and this is the optimal schedule. It'd be great if I had that, but I don't. So that's why, having data such as provided by the fasting mimicking diet really is sort of useful, because at least they've studied it. right? I can point to studies that say, yes, this is going to have benefit. The other ones, I have to measure the benefits. So I have to do it sort of manually. That is, I have a patient in my office, I tell them do this, and then I have them come back and say, okay, how are you doing? Like, are you getting the results? If not, then let's change it and go from there. So it's more individualized, but that's hard to make a recommendation to the general public about how to do that. Because some people will do 16-hour fasting. 16-8 is very common. Some people do great. A lot of people, it's not enough. So then you can do one meal a day, which is 24 hours of fasting. And that's a very popular schedule as well. And some people do great. And some people do 3 days of fasting, 5 days of fasting every few days, for example. So it really depends. Personally, I do a lot of sort of 16-hour fasts. I do some 24-hour fasts, but I also do a 5-day fast every so often, just to maintain benefits. If there are benefits to the longer fast, then at least I get both the benefits of short fasting and long fasting. So in general, I recommend sort of short fast on a reasonably routine basis, and then doing a longer fast when you need to, for example. So even right now, I'm in the middle of a 4-day fast, and I do it when my schedule sort of allows me to do that, and it makes it easy. So, and again, you don't have to do a full fast. Like, you might have a little bit of vegetables here and there if you want to, and that's what the science has said, is that you don't have to worry if you do take a little bit of stuff. You're still going to get a lot of the benefits of doing that. So I take a bit of vegetables during my fast, and it makes it much easier.
Can you give an idea of what kind of things like vegetables specifically people can get away with eating while they're fasting?
Really, probably any vegetables. Leafy green vegetables is what I do. Again, what I do is just based on my best guess, because there's not a lot of studies that do this. Because, as you might imagine, it's hard to get somebody in and say, okay, let's get these people and put them on a 5-day fast. And, so I do basically boiled or stir-fried vegetables, broccoli, bok choy, napa cabbage, that kind of thing. And I take that once in the day that I'm fasting. Like, as I said, it's quite individual. So what I actually do is the first 2 days, I don't take anything but water and green tea mostly. And then in day 3, day 4, I do some vegetables, just to make it a little bit easier for myself to get through the 5 days. It makes it easier not only from a hunger standpoint, but it makes it easier from a social standpoint. So if you're having dinner with somebody, usually my family, then I'm not just sitting there drinking some tea. I'm actually having a little bit of vegetables or a little salad or something like that. So that's just what I find works for me. But other people, could do it differently, and I wouldn't have any problems. The key is to get results. And if you're getting good results, then keep doing what you're doing. If you're not getting good results, then try something else. And this sort of longer fast, with a little bit of food, so it's a modified fast, can be very effective for people.
As Dr. Fung illustrates, personalizing the FMD to your own needs is crucial. Different strokes for different folks. With that said, to give you a general idea of what's acceptable to eat on the FMD, here's what UCLA Health lays out in an article on the topic. It says the diet can include non-starchy vegetables like celery, zucchini, tomatoes, and leafy greens. Whole fruits like berries, apples, and oranges are also permissible, it says. It lists avocados, walnuts, and olive oil as providers of essential fats which won't blow out your protein or carbohydrate quota. The FMD restricts foods like white rice, white bread, bagels, refined sugars, processed foods, dairy animal proteins, and starchy vegetables, which are all high on the glycemic index. And now, Dr. Fung, I'd like to digress just a little bit from the fasting mimicking diet to the topic of salt. I know this is often recommended as a way not just to improve kidney health, but to preserve health in general, is reducing salt intake. Is reducing salt intake really that important to preserving kidney health?
Yeah, that's a great question, because for years and years and years we're told, eat less salt, eat less salt, eat less salt. If you don't have any significant kidney disease or just mild kidney disease, then for the most part, most people don't have to worry. because if you eat a lot of salt, your kidneys would just get rid of that salt. So it's not a problem. However, there are certain people who are considered salt sensitive. And this is particularly important in a lot of blacks, Africans, and people of African origin. For genetic reasons, they are very salt sensitive. So that when they take a lot of salt, their blood pressure actually goes through the roof. That's very, very, so for those people, it would be very important to cut back on salt. But for the general population, for most people, it doesn't seem to be that important. And this is controversial because a few years ago, about 6 or 7 or 8 years ago, the Institute of Medicine undertook a big study. They looked at all the studies of salt and so on, and looked at outcomes, that is heart disease and so on, and they really couldn't find any link. In fact, the link they found was the opposite. The people who ate the most salt had the least heart disease, sort of thing. So almost opposite of what you would expect. So they said, well, this is really hard to tease out whether or not salt is really that important. Like, should you eat less salt, or should you actually eat more salt, or should you eat what we're eating now? And that's where it's sort of left. The studies are sort of inconclusive. A very extremely low salt diet does actually put a lot of stress on your body and actually can be detrimental. So the Institute of Medicine sort of said, well, we should eat sort of between 2 and 4 grams a day, which is actually what the American average is. So it's sort of like, let's just leave things as we are. But the extremely low salt diet is probably not something I would recommend, except in the case of advanced heart disease, advanced kidney disease. Then, of course, that's a completely different situation. If you're on dialysis, your kidneys can't get rid of the salt, so therefore you do have to be very careful. And heart disease, same thing. Your body can't get rid of the excess salt, so therefore you must be much more careful. But for the most part, it's just a matter of I think that somewhere in the middle is probably a good place to be. Don't be extremely low salt and don't be very high salt, and just stick with where we are. But people have this idea sometimes that you should always cutting back on salt gives you all this benefits for no risk. It's not exactly like that. There is some risk to these things. So just to be aware and be careful. But salt, for the most part, is not something people need to be super concerned about.
How do renal diets for those living with kidney disease deal with protein, carbs, salt, and other food elements? We'll hear in just a moment. First, though, how do our levels of the feel-good hormone dopamine affect our attention and influence ADHD? Here's a look at my interview with psychiatrist Dr. Daniel Amen.
Why do people jump out of perfectly good airplanes? You have to ask yourself that question. They're always seeking more dopamine. We all have only so much store of dopamine available. People who have ADHD actually have less. They can be conflict seeking. They poke at other people and they play this game I call Let's Have a Problem. ADHD is a very common but increasing problem. Probably half of the children we see and maybe a quarter of the adults.
We know that caffeine can raise dopamine levels, which would in turn improve focus, including for people with ADHD. How do you rate caffeine as an overall positive or an overall negative entity? Afterward, find the link to that video at the top of the comments and also in this video's description below. And if you're finding this video helpful, please be sure to share it with family and friends by clicking the share arrow below. Looking at the kind of recommendations that are out there for chronic kidney disease, it seems to go from bad to worse in terms of what's restricted in diet. I noticed it's low carbohydrate, then it goes on to you need to avoid too much protein, you need to cut out salt, you need to cut out phosphorus, potassium. It just seems to get more and more, the tunnel gets more and more narrow as you go on. What would you say is the nucleus of really dealing with CKD from a dietary standpoint?
Yeah, so the typical renal diet is low in all those things because normally the kidney would get rid of any excess sodium or excess potassium or excess phosphorus. Your kidneys will just get rid of it. So you don't have to worry about it. You don't have to think about the sodium or potassium or phosphorus that's in your food because your kidneys will deal with it. When your kidneys don't work and we have to deal with it on a dialysis machine, well, it gets easily overwhelmed because we don't we don't clean the blood to the same extent as your natural kidney function would. So therefore, it's a very highly restrictive diet. So even protein, a lot of the excess protein waste, nitrogen waste, is excreted through the kidneys. So it has to be relatively lower in protein and all this sort of thing. Because when you eat protein, you generate this nitrogen waste product, which the kidneys normally get rid of. Just like the phosphorus. And it's very high in phosphorus too, and the phosphorus is something that the kidneys normally get rid of. So for most people, eating a higher protein diet is actually quite a good thing. You can eat less carbohydrates, replace it with proteins and fats, for example. But when you're on dialysis, your kidneys can't handle the higher protein because of this waste product that's being generated that you can't really get rid of that easily. The phosphorus can't get rid of that easily. The dialysis that we do doesn't get rid of them very efficiently, and so therefore those levels can build up, and that can be detrimental. So it's not for people who are trying to reverse their kidney. If you're not on dialysis, then that's not something you have to worry about. People used to worry that high protein diets would cause kidney damage, but they don't really. It's that when you have a lot of kidney damage, your kidneys can't handle that amount of protein. You can still eat the normal amount of protein, but a very high protein diet is something you might want to avoid. But that's specifically for dialysis diets. It's a very tricky sort of diet to face. And the thing is that doesn't actually help the kidneys itself. You're only dealing with the consequences of the kidney failure. So the kidneys isn't getting rid of all this stuff, so you're trying to eat less of this stuff.
Dr. Fung, thank you very much for joining us today and sharing this very exciting development in what they've found out about the fasting mimicking diet and some practical tips on how to apply that.
Thank you so much.
We've learned how the FMD can help replenish the kidney's glomerular filtration barrier, which is particularly hopeful for those suffering chronic kidney disease. We learned about the likely autophagy mechanism of FMD, and we learned how Dr. Fung puts the fasting mimicking diet into practice himself, eating things like broccoli, bok choy, and Napa cabbage. To hear Dr. Fung's nephrologist overview of chronic kidney disease, CKD, and to hear about a promising traditional Chinese medicine CKD formula, just click the link at the top of the comments or in the description below. Also, the link to my talk with psychiatrist Dr. Daniel Amen on the dopamine cause of ADHD and how it can naturally be treated is also in the comments and the description below. You can subscribe for ongoing access to Epoch TV news and health insights by clicking that big red button below. It's been great to be with you. I'm Brendon Fallon, and this is Vital Signs.